Assalamu alaikum, good morning. My name is Iain Tulley. I'm the Chief Executive of the Mental Health Service at Hamad Medical Corporation, and it's my pleasure to wish everyone today a very happy World Mental Health Day. My apologies that I can't be with you. Unfortunately, I have a number of other commitments and I got my timings mixed up and was not able to join you today. But first of all, I'd like to thank Gulf Good Vibes for organising this event, and I'd like to congratulate Gulf Good Vibes for the work it's doing in Qatar and across the Gulf. The World Mental Health Day is a powerful reminder to all of us that there is no health without mental health. The broad objective of World Mental Health Day is to raise awareness globally about the importance of mental health and well-being in our physical well-being and in our life in general. It emphasises the importance of mobilising our efforts, bringing people together, getting stakeholders to talk together to ensure that we improve services, access to services, and most importantly, awareness about mental health. And as I said a moment ago, I wanted to commend Gulf Good Vibes for organising this event, but I also want to commend them for the work they're doing in our country here in Qatar to raise awareness, to mobilise support, and to create a movement around mental health, and probably most importantly, to build capacity within our communities so that people can thrive even when they're in times of difficulty. So my thanks and commendation to Gulf Good Vibes, and I wish you well in keeping going and keeping up the good fight for mental health. Now, this year's theme in 2025 is mental health in humanitarian crisis. Now, I think we would all agree that there has been no time, certainly in my living memory, where the world has been in such a parlous state, where there has been such unrest, such human suffering, and such a loss in terms of life, quality of life, and family living. Working in Qatar in such a diverse culture, with such a diverse workforce and diverse populations, we will all have friends, colleagues, family members who are victims and or collateral victims of the terrible sufferings that is happening all across this region and across the wider world. So I think today is particularly poignant when we start to think about, if we can't support people in the areas of conflict and humanitarian crisis, how do we ensure that we support those people who suffer as a result of their families, their friends, their relatives who are suffering in far off places? So I guess my request today is that as we think about mental health generally, and we think about raising awareness, creating a movement, mobilising things locally, we give one or two thoughts to those people who are suffering in our communities because of what's happening elsewhere, and think about ways that we can support them to work through these difficult times. Thank you very much for all you're doing. I wish you a very good day. I wish I could be there. And as I said at the start, a very happy World Mental Health Day. Thank you very much.